Disorders, NJCTS, and its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation nor opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now, I'm going to turn over the introductions of our speaker to Martha Butterfield, the Program Coordinator of NJCTS. Marty?
Thanks, Kelly, and good evening, everyone. And thank you for joining us for another presentation in our Wednesday webinar programming. Our presenter for this evening is Dr. Shawn Eubank, who received his undergraduate degree from the University of California at San Diego and his graduate degree in clinical psychology from Rutgers University. Dr. Eubank is a doctoral level therapist with almost 10 years experience in the field of behavioral health, working with children and families living with OCD, ADHD, Tourette syndrome, anxiety disorders, and rage. In particular, he has specialized in behavioral and crisis management for children, adolescents, and adults. While at Rutgers, he was a clinician in our TS practicum at the Graduate School of Applied and Professional Psychology before leaving to develop specialized expertise in treating college-age population at UCLA's Counseling and Psychological Services. He's now back on the East Coast, a therapist in a Manhattan private practice, and he has returned to our Tourette syndrome clinical program at Rutgers, where he provides evaluations, psychotherapy, and clinical supervision. Additionally, he trains and supervises graduate students in cognitive behavioral therapy in the Rutgers Clinical Psychology doctoral program. So it's with great pleasure that I turn tonight's presentation over to Dr. Eubank.
Thank you, Marty. Just give me one moment with my slideshow. Okay. I would like to thank the New Jersey Center for Tourette Syndrome for inviting me to speak and to compliment them on their wonderful webinar program. As a listener, I have gotten a lot out of the program. I am glad to be able to give back a little as a speaker. As Marty said in her introduction, my name is Shawn Eubank. I am the Assistant Director of the Tourette Syndrome Program at Rutgers University in New Brunswick. The Tourette Syndrome Program is a training clinic for doctoral candidates in clinical psychology. We provide evaluations and cognitive behavioral treatments for individuals with Tourette syndrome and associated disorders, such as obsessive-compulsive disorder, ADHD, behavioral difficulties, including rage attacks, anxiety disorders, depressive disorders, and trichotillomania. In addition to my role in the TS program, I also have a private practice in Manhattan where I provide similar treatments and see a wider range of clients with the various disorders that I listed. Tonight, I will be discussing how to build positive social environments and decrease stigma for children. To give a trajectory of this talk, first, I will explain the potential impact of anxiety that is often created in circumstances where a child faces stigma due to having a visible difference compared to other children in their environment. Next, I will talk about a couple of general solutions that will form the basis to building positive social environments. Then, I will consider the specifics of how parents, teachers, coaches, and adult leaders within a child's various social environments can work in collaboration with the child to form positive social environments and to help the child become an advocate and at times a spokesperson for themselves. While any child can benefit from adults who have a thoughtful strategy for building positive social environments, my talk will focus primarily on children with visible differences. I am coining the term visible difference and will use it throughout this talk. What do I mean by visible difference? A visible difference is anything noticeable in a child's appearance or behaviors that is different from most other children in their environment. Let me make this more clear with a little background into my own work. I have a lot of experience working with families of children with Tourette syndrome. Children with Tourette syndrome have motor and vocal tics. Tics can be relatively minor, like repetitive eye blinking, head movements, or soft humming or grunting sounds. Tics can be quite severe, with entire body movements like spinning or running, or with loud shrieks, or with words being repeated. Tics can manifest in many different ways with different repeating movements or sounds. Many tics, even minor ones, are noticed by other people, with more attention drawn as tics become more severe. These tics are an example of a visible difference. As much as we are a society that embraces uniqueness, visible differences are not inconsequential. Oftentimes, visible differences result in a negative or stigmatizing reaction from others. As a result of this reaction, an individual with a difference often suffers anxiety because of their difference. Going back to the example with the individual with tics, people notice an individual with tics and will likely have a covert, if not an overt, reaction. As the individual with visible tics, you live the experience of watching others watching you. As far as their tics go, children with tics do not get to choose if others are noticing them. Tics, which are largely out of the control of the child, result in the child being noticed. Why are children with tics noticed? Well, it is human nature to notice other people. In particular, we notice people who are different. It is human nature to make assumptions and judgments based on what we notice. Unfortunately, our judgments about people who are different or things that are not well understood are too often negative. A child on the receiving end of a potentially negative judgment often experiences considerable anxiety. This anxiety comes from the stigma of negative judgment that results from a visible difference. The goal of the talk today is to offer understanding and strategies on how to decrease stigma-based anxiety. Tics are just one phenomenon that lead to stigma-based anxiety. Unfortunately, there are many, many situations that often cause stigma and lead to similar anxiety. Children who are unable to walk face stigma because they use assistant devices such as wheelchairs. Children who are hyperactive face stigma because they blurt things out or have trouble sitting still. Children who are in special education classes face stigma because they struggle academically or behaviorally, or even because they ride a different bus than other children. Children who are overweight face stigma because they are not meeting society's standard for body size. Children who are one of the few in their ethnic or cultural group face stigma because of their differences in appearance or their differences in custom. If you are the tallest kid or the shortest kid in your class, you may very well face stigma. If you are a kid who has glasses or a kid who has braces, you may also face stigma. In any of these situations, the potential for stigma brings the potential for anxiety and shame. Now, we could say that what doesn't kill us makes us stronger. All children face challenges growing up. sticks and stones, right? As a behavioral psychologist, I often encourage clients, adults and children, to endure anxiety-provoking situations as a path to improved mental health. But there's a big difference between various anxiety disorders and anxiety that is brought about by stigma. Let's talk for just a minute about some of the research on stigma due to visible differences. In the interest of time, I am not going to go into a detailed analysis of the data on this subject. Instead, I will tell you about the trends in the research. Generally, research indicates that children with visible differences have more difficulties in peer relationships, social functioning, and future occupational functioning. Also, children with visible differences are more likely to have mood difficulties such as depression and anxiety. There is further evidence that they score lower on quality of life measures. Consider also that research on peer reactions suggests that peers describe children with visible differences less favorably than children without visible differences. Now, I am not presenting these research trends as a reason to lose hope. What they are suggesting is that a child with a stigmatized visible difference is more likely than one without a visible difference to have a little more trouble. There are plenty of children with visible differences that are functioning fine. There are also plenty of children without visible differences that are struggling. Still, as an adult, it can be useful to know how you can be most effective in limiting a child's struggle. So let's talk about a solution. What can you do to help a child with a visible difference? For the purpose of this short talk, I have broken the solution down into two components. Let's talk about these components and then talk about how to implement them. The first component. If you're looking for direction on how to create positive social environments in situations of stigma-induced anxiety, this component can be your guiding light. Positive social environments are formed when the child is comfortable talking about their visible differences within the environment. What does this mean? This means that the child who cannot walk is comfortable saying that she is in a wheelchair. This means that the child who is hyperactive is comfortable saying that she has ADHD. This means that the child who has tics is comfortable saying that he has Tourette syndrome. This means that the Asian American child is comfortable saying that his parents immigrated from Korea. More than this, it means that these children are willing to enter into conversations about what it is like to live with their difference. So why is it helpful for children to feel comfortable talking about their differences? Two reasons. First is the benefit to the child. Imagine a child who is keeping their difference a secret. For children and adults alike, secrecy promotes shame. A child who does not talk about their visible difference usually believes that the difference is not acceptable to talk about. There are plenty of things we do not want our children saying because they are not acceptable. As adults, we discourage profanities, bigotries, insults, threats, and lewd statements. Consider that the child who is not able to talk about their difference finds their difference similarly unacceptable. If we want to take steps towards a child accepting his or her difference and towards a child experiencing positive social environments, even in the face of their difference, we have to get them talking. Being willing to talk about difference decreases the sense of secrecy, decreases the sense of shame, and decreases the anxiety about the difference. So the first component in creating positive social environments in the face of visible differences is to encourage the child to talk about their difference. Let's talk about the second component and then talk about how to implement these components into social environments. The second component is to provide knowledge to the people within your child's social environment. When a child or adult selects disclosure instead of secrecy, everyone benefits. Just as secrecy promotes shame in the child with the difference, secrecy promotes stigma from everyone else. The differences being discussed today have already been named as visible differences. Everyone else is already noticing these differences. When people notice differences that are being kept secret, they're left to make their own judgments. Unfortunately, these judgments are often negative. Different can become weird or nerdy. Different can come to mean that a child is stupid or that they should be avoided. These judgments are made in ignorance, but the unfortunate reality is that these sorts of judgments are made all the time. So why does talking about the difference help? Because it provides everyone else with knowledge about the difference. And knowledge is powerful in decreasing stigma. When people know what is going on, they do not make their own judgments, and they are much less likely to make negative judgments. Let's take an example. Consider a child who has asthma. Their asthma may disrupt their athletic performance. It may cause them to have to stop in the middle of games or in the middle of races. It is the sort of difference that can really get in the way of everyday childhood functioning. And yet, we do not hear very much about children with asthma being made fun of. We do not hear very much about children with asthma feeling ashamed because they have asthma. Why is this? Simple. Everyone knows what asthma is. They know it causes difficulties with breathing. When other children see the inhaler, they think, oh, Sally must have asthma. When Sally stops in the middle of the race, they say, oh, she is stopping because of her asthma. The knowledge of the other children spares Sally the harsh judgment and stigma. So let's review our two-component solution for building positive social environments for children who are at risk of anxiety and stigma due to a visible difference. First, we want to help the child to become comfortable in talking about their difference. Second, we want to provide others with knowledge about the visible difference. As adults, there are a lot of things we can do to facilitate both components of this solution. Let's talk about how we can do this. Let's start with what adults can do to help a child become comfortable talking about their difference. The first and most important suggestion I can offer is for adults to make sure that they themselves are comfortable with the child's difference and that they are comfortable talking about the difference. Adults can gain their own degree of comfort in two ways. First, they can educate themselves about the child's difference. Second, they can find places or people where they can talk about their child's difference and what it is like for them, the adult, to have a child with a difference. In my clinical work, I see lots of families where the child has ADHD or OCD or tics or explosive outbursts or anxiety or depression. In any of these situations, before I initiate a treatment or before I make a referral to another medical professional, my first step is to educate parents about what is happening and what to expect. My next step is to encourage parents to talk about their experience. Oftentimes, it is useful to learn about what sort of support system parents have in place. If there is no support system in place, I will often brainstorm with parents where they can go for ongoing support about their child's difference. I do this because I believe that when parents are knowledgeable and have support around their child's difference, they are in a much better position to help the child. Now, this idea that an adult's knowledge and social support will help the child is not limited to parents. I just happen to work with a lot of parents. This idea applies to any adults in a child's life. It applies to teachers, coaches, relatives, and medical professionals as well. That said, I want to encourage the listening audience to take a moment right now and to think about your level of knowledge about the visible differences of the child who brings you here tonight. Also, think about your level of comfort talking about these differences to people in your support system. It is pretty common that adults who all lead busy lives may not have the level of knowledge that they could or the level of support that they need. For the audience tonight, I encourage you to pursue these things for yourselves. Further, I encourage you to serve as supportive listeners and educators for other adults who are parents or who work with children who suffer anxiety or stigma due to their visible differences. Lastly, I encourage you to be supportive listeners and educators for the adults in the life of the child that has brought you to this talk tonight. Realize that children are keen observers of even the most subtle adult reactions. A child who is surrounded by adults who are comfortable with them and their differences will feel accepted. That alone can have a profound impact. Still, I am advocating for even more. I have suggested that the child will benefit from being comfortable talking about their difference. Interacting with accepting adults is a big step towards creating this level of comfort. But let's talk about other things that we can do. If a child is uncomfortable talking about their difference, I want to create opportunities and activities where they do feel comfortable talking about the difference. There are lots of ways to do this. Here are some of the things that you can do to increase a child's comfort level so that they begin talking more about their differences. First, when possible, attend events with children who have similar differences. My best example of this is within the Tourette syndrome community in New Jersey. Every year, the New Jersey Center for Tourette Syndrome hosts a weekend at Camp Bernie for families of children with Tourette syndrome. This is a fabulous opportunity for kids with Tourette syndrome to interact with each other in a fun setting that encourages discussion of tics and other things that come along with Tourette's. Moreover, the camp encourages parents of children with Tourette's to interact with each other. It also encourages siblings of children with Tourette's to interact. Along similar lines, within the Tourette syndrome community are the yearly groups conducted by my very own clinic, the Tourette Syndrome Program. Every winter, we invite families to participate together within our group program. We offer social skills groups specifically designed for children with tics. We also provide a parent support and education group and a sibling support and education group. Feel free to contact me, the TS Clinic, or the New Jersey Center for Tourette Syndrome for more information about these opportunities. For those of you outside the TS community, I encourage you to look for similar resources within your area of concern. A second way to get children talking about their difference. Buy children's friendly literature on the topic of the difference and read the books with the child. The internet is an amazing place to find these books. I encourage any adult to put in the simple search terms for books for children with, and fill in the blank, children with OCD, books for children with disabilities, books for children with allergies. This is a great way for kids to begin to talk about what is going on with them in a way that does not put direct pressure on them. A third way to get children talking about their difference. Find ways to incorporate the child's difference into play activities to get children talking about their experience in child-friendly ways. An example would be a puppet show where one of the puppets has ADHD, just like the child. Or an art activity where a child is asked to draw their difference, or to make a comic where they tell their teacher or a friend about their difference. Another example is to make a Jeopardy game where kids can win prizes by learning facts about their difference. Be creative with any play activity that gets the child talking about their difference in a fun way. A fourth way to encourage a child to talk about their difference. Designate a special time during the week to talk about the difference. Children respond well to structure. One of the advantages I have as a therapist is that a child I am working with already knows that they are coming to see me to talk about the particular thing that we are working on. So the anxious child that I have been working with comes to my office ready to talk about anxiety. Likewise, the parent of an anxious child could have a designated time during the week where their child gives them an anxiety update. This can be followed by a special activity or a treat that the parent and child can enjoy together. Teachers can set up the same thing, maybe at the start of a break period once a week. This again gives a child opportunity to gain comfort talking about the difference. A fifth way to encourage a child to talk about their difference can come when the child has shown some comfort talking to you about their difference. When this has happened, begin to make plans with the child to tell selected others about their visible difference. The child should be encouraged to pick people that they would feel most comfortable telling first. Consider practicing these conversations ahead of time. For example, have a practice conversation where they tell their best friend, or where they come along as you tell their teacher for the new school year. All of these strategies are designed to increase a child's comfort level. As you see, the last step begins to plan greater levels of communication with selected others. The goal here is that over time, the child is becoming an advocate for themselves within different settings. In addition to using greater levels of communication as a way for the child to gain greater comfort, this step also begins to serve our second goal to reduce stigma by educating people in the child's environment about the child's visible difference. This does not mean that a child has to tell everyone about their difference in every place they go, but that they can make thoughtful decisions about when it is useful to talk about their difference. For example, it may be useful for a child with ADHD to comfortably discuss the implications of their diagnosis in math class, where they are easily frustrated. For the same child, it might not make any difference if they talk about their ADHD at basketball practice, where their ADHD isn't even apparent. Now, it is important to have reasonable expectations about a child's ability to communicate based on their age, their abilities, and their personality. For younger children or less able or more shy children, adults often communicate on behalf of the child. While it is useful for the child to learn the skills of self-advocacy over time, there is nothing wrong with adults stepping in when the child is not able to advocate for themselves. When adults are stepping in, it is important to involve the child as much as possible. A common question here is, how are adults supposed to determine the child's level of involvement? This is a tough question because every child is different. I have known precocious 5-year-olds who can talk about their tics or OCD or attention symptoms with anyone. On the other hand, I have known adults with Tourette syndrome who cannot even say the words tics or Tourette's in the privacy of my office. So adults, I encourage you to think carefully about the child's age, ability, and level of comfort. Tailor the strategies that I have offered to the individual child. Pick the techniques that are most suitably based on what you know about the child. To give some clarity about the range of choices, let me provide an example of a model for decreasing stigma and encouraging self-advocacy by providing knowledge about a visible difference within the school environment. I must once again refer to the fine work of the New Jersey Center for Tourette Syndrome. NJCTS has a school in-service program where parents and schools can request speakers that give presentations to groups of teachers and school staff, and that further give presentations within the classroom of a child with Tourette syndrome. The in-class presentation educates other children about visible differences in order to reduce stigma in the classroom. An important aspect of the presentation is the child's involvement in the presentation. They are given 4 options for their level of participation in this classroom presentation. First option is no participation, where the child is absent during the presentation. This option helps the child so that they do not feel singled out during a presentation that could reasonably cause them anxiety. Second option is the child participates as an unmentioned member of the audience. In this case, the child is in the room, but their only job is to listen to the presentation along with the other kids. In both the first and second option, the child is not singled out as a topic of discussion. The presentation focuses on various visible differences, not on the child's specific visible difference. The third option is the child is not only in the room, but they also participate in the presentation by identifying themselves as someone with a difference, and they say what the difference is. The fourth option builds on the third option. In this option, not only has the child self-identified, but this option gives them part of the presentation time where they can talk to the class about what it is like to have their difference. Professionally, I am an advocate for the child participating in the discussion about their difference. I believe that a child who has invited a dialogue about their difference has maximized the potential for a positive social environment. The child who does this in one environment can do it in others. In other words, the child who comfortably talks about their difference at home is more likely to open up to close friends, and then is more likely to open up at school, and then is more likely to open up within various life activities. For every child, self-advocacy is not an event. It is a process. Thoughtful adults should consider where the child is on the path toward self-advocacy. Knowing this can help you plan where to start in building a positive social environment. To sum up, Let's review the main points I have covered. Number 1, children with visible differences have a high likelihood of experiencing anxiety within their social environment due to stigma. Number 2, research suggests that a child with visible differences is at greater risks for long-term difficulties in social, academic, occupational, and emotional functioning. Number 3, shame and anxiety can be decreased by encouraging children with a visible difference to talk about their difference within various environments. Number 4, there are many steps and strategies that will help to increase a child's communication about their difference. For example, exposing them to others with the difference, spending time with child-friendly literature or play activities that focus on the topic of the difference, and creating structure around communicating about the visible difference as it affects the child. Number 5, stigma can be decreased by increasing awareness and knowledge of others in the environment. This concludes my talk. I thank you so much for your time, and I will now turn things over to the facilitator to open it up for questions.
Thank you very much. Great presentation. Have a number of questions that have been coming in, so I'm going to kind of leap right into those. And one of them is more of a comment and part of a question, okay?
Okay.
Would you address the implications of not explaining to your child about their diagnosis, whatever it is? It could be Tourette in this case, or or something that's visible, so that they can become comfortable and understand what's going on with them. It's been my experience that kids, in the absence of knowing and understanding what's going on, they make up stuff, or they imagine all sorts of things that are often not true about their situation. And I get that this has to be age appropriate and all of that, but kids have a really vivid imagination, and it generates a lot of anxiety for them when that's unfounded, when they really don't understand.
Yes, that's a very well put comment. But it's a tough one, I think, for adults and for parents especially, because I think a lot of times a very young child who is showing some difference might actually not be so anxious yet. And so I think it can become easily comfortable to not talk about the difference. The worry here is that over time, the child becomes more and more aware that something's going wrong, that something is different. And the very things that I talked about, I think that they oftentimes can be their own harshest critics and might subject themselves to, again, negative explanations about what's going on. And so I happen to advocate that more knowledge for the child is really helpful. And I really try to be pretty upfront with children about what's going on based on kind of their age level and their ability to understand.
Okay, well, I'll share something with you. I have said to parents when I've had a similar conversation with them that I've said it's kind of like talking to kids about where babies come from. You know, you tell them what they need to know that's relevant for their age, and it answers their question, and you move on. But it's the not answering and the hiding that I think makes it really complicated and more stressful for the kid.
Right. What I'd advise parents is that they're in the habit of talking about these sorts of things and doing it in an appropriate and thoughtful way. And so yeah, there might be less specific information for a younger child, but at least you're kind of preparing the child for these are the sorts of things that we talk about, as opposed to these are the sorts of things we ignore.
That remain hidden. Okay, regarding anxiety, are there common red flags that a parent should pay attention to, such as nail biting or bedwetting or things like that, that kind of would be that, that kind of happen maybe out of the blue, that all of a sudden the parent really needs to pay attention to?
You know, there are red flags, and those are the sorts of examples. I'm a little cautious here because children are so different. So you could very well have a kid who is showing no visible signs that they're anxious, but still could be. But some of the things that I look for, beyond those sorts of physiological things we notice, where if you notice that a child is getting panicky, or they are biting their nails, or they are having trouble sleeping, I might also look for avoidant behaviors, where a child doesn't want to go to school, where they don't want to participate in activities in their life would be a really good sign.
So avoidance then, yeah.
Yeah, avoidance would be a big one. A lot of kids, when they're worried, they're looking for a lot of reassurance. So that would be another one, where they're asking parents or teachers if things are okay or if they did a good job, but they're really persistently doing it in a repetitive way, where it becomes the parent's job to kind of give immediate gratification. That's a good sign of an anxious child. But my caution I mentioned earlier only comes from the idea that I could imagine a child, especially one with a visible difference, that has gotten really pretty skilled at not showing that they're actually under a lot of duress and under a lot of anxiety. So I would love for the communication to precede this realizing that there's a problem, because I think that the problem might come first. And I hate this idea of a child who's very anxious but nobody knows about it, because oftentimes anxious children really function pretty well and behave very well.
Mm-hmm. Okay, question from a parent: how do I get my child to recognize his differences when he doesn't accept that he has Tourette?
That is an excellent question. And hopefully my talk spoke to that a little bit when I talked about the strategies. But the approach that we use within this clinic is usually to try to enter into conversations about the matter, say Tourette's and tics, without having a specific discussion that's about the child's Tourette's or tics. And so this is where the resources such as getting books where other characters have tics. So now at least you're starting where the child has opportunities to talk about these sorts of things, or that doesn't have to do with them, or learning about celebrities who have tics, or even the exposure to other children, so that the child can kind of talk about the situation without having to say, well, and I shake my head and I make a chirping sound. So this would be kind of the first step, where you're really trying to ease children into talking about the phenomenon before they have to talk about their own experience of it. And that would be where I started. And if a child really is continuing to have trouble talking about it with the parent, oftentimes I think that those might be the sorts of children that we end up working with, where seeing a psychologist or a therapist can be helpful of giving the child a specific place where they can go to start talking about these things, with somebody who actually has specific training to gear towards getting children to open up.
To understand, okay. Is there any evidence that kids with anxiety become bullies to kind of cover up their stress or feelings of frustration or anything like that?
You know, that's an interesting question. I don't know the answer to that, where if children who are anxious become bullies. Now, a couple of things that are sort of similar to that line of thinking is that Well, a lot of anxious children might really sort of shut down and close up and avoid. There are certainly a subset of anxious children who might have a more explosive reaction, that are the anxiety folk who get really angry or upset, and when confronted with their anxiety become more explosive. Though I wouldn't tie that specifically to bullying. Um, but where it becomes more interesting is, I think, kids who are facing stigma and who are being made fun of themselves, one way that some kids react is to actually show more bullying behavior. So a child who is a bully oftentimes is somebody who's been subject to bullying in the past. But I don't know of evidence that directly links anxiety. It is possible that there is, but I'm just not aware of it.
Okay, that's fine. How can you help a child who understands his or her difference but still feels that they are not part of the group and continues to feel excluded?
So maybe you could repeat the question.
Sure.
Yeah.
All right. How can you help the child who understands their difference but still feels that, you know, they're not being part of the group and continues to feel excluded? So they understand what's going on with them, but they just can't get rid of that feeling, it would seem, that they're just being excluded, you know, maybe not getting invited to the parties or the birthday things. I don't know how old this child is.
Right. Okay. Well, the first thing that I want to acknowledge here, especially working within the Tourette syndrome population and a lot of times with children with ADHD, is it might be the case that the child is well aware of their difference and that they are indeed being excluded. And so that might be something that a child is struggling with. And I see this particularly with children who have ADHD, where children sometimes will be more excluding of them. And so if that's the case, I mean, one thing is to acknowledge to the child and try to get them talking about sort of the hurt and upset of being somebody who is not as included. Is sort of the first step, is to actually be in communication about that reality with the child, where it's very tough for them. But then, of course, the second piece to that is to try to find places where they can feel excluded, or where they can feel included. So finding that they can have somebody where they do have a friend, if it's a child who is without friendship, or where they have something that they can be involved with, where they actually are having positive interactions with children of their age. And this can be really challenging for parents, because I think a lot of parents are trying to do this and it's really not working. Mm-hmm. And so depending on the situation, I mean, the next thing that I would think is that if this child is really not succeeding, then as a psychologist, I mean, if I was seeing this child, I would really want to start to identify and understand what's going on with the child. And a lot of times I might make the assumption that if it's not stigma, so we talked about how to educate environments of people with stigma, but if that's already been done, that I'm wondering what sort of skills a child is lacking. So if it's the ADHD child and they're always interrupting and they're very bossy, or it's the OCD child and they're very controlling with other children, as a psychologist, I would be trying to dissect this, because what I would really want to do is to start learning ways, or teaching parents ways, or teaching children ways that they can start increasing their skills so they can actually be more successful. Because if there's a skill deficit going on, then you're going to want to address that. Otherwise, they might just continue to be excluded.
So the parent then needs to be able to better identify what's going on with the child, to see if the child is kind of perpetuating that environment. Is that a way to say that?
Yes, that's not exactly the way that I would say it as far as they're perpetuating the environment, but I guess the way that I would see it is if there is something going on, say a skills deficit, then that deficit is really getting in the child's way. Um, and that until the adults in the child's life have a really good understanding of what's going on and what's getting in the way, it's going to be hard to form solutions. And this is, again, sometimes a situation where a behavioral psychologist or therapist could be useful in trying to help parents to dissect that. And in a way, I mean, it's a very complex question because different kids are different, so it could be so many number of things that would be going on.
All right. Well, thank you. Your reply was a good pass at that question. Thank you.
Thank you.
Often, let's talk a little bit about the time frame for diagnosis, and we'll, again, TS in this case because that's actually, how the question is posed. But you know that there's often a lengthy visit cycle between doctors and counselors and stuff that goes on before you get a diagnosis or before someone, might even recognize that it might be TS. So as you're going through this process with your kid, there are any number of instances that come up that create frustration and questions and anxiety in the family trying to figure out what's going on. So, so any suggestions on that, or can you give any advice in that area with how to deal with that kind of stress? And it may not just be TS. It's, you're waiting for a diagnosis on anything. You're trying to figure out what's going on with the kid.
Yeah, this is a common thing that happens, and it's really very challenging. And I almost imagine the person who asked that question might actually be on the other side after having had a really frustrating road to this diagnosis. And the reason I say that is because I think oftentimes there's not a great solution if people are not sure what's going on. Now, sometimes it might be the case that, you're really pretty confident about what the diagnosis is, but you're still sort of in the midst of a process.
Yes, and that process sometimes, too, is a problem with the schools because you don't get action until you get the decision, and the decision is a long time coming.
Right. And so this can be really a challenge. And I can even say within our clinic, where I think once we're at the evaluation point, we try to move quickly, but even still, it can be a time-consuming process. And it's very frustrating for parents and child alike to be kind of playing the waiting game while all the same problems that brought them in are still occurring. And it involves a measure of patience. The thing that I would encourage is the better that adults can be in communication and trying to brainstorm what to do and feel like that they have a plan and they're talking to the child about the plan, the better. And this might vary, but in the school, it might be that you don't have these accommodations in place yet that would be helpful, but maybe they're actually people at the school. It's the teacher or a counselor or somebody who can still be a bit of an advocate and a support source for the child. Because in a way, it almost becomes a situation where now the child and the parents end up needing a bit of support themselves just for almost like the trauma of the process of getting the information. And I think that's really hard. So I feel like I don't have a great answer to it. My best answer is to have parents just continue the struggle and hopefully moving in the direction of actually getting the resources and then not ignoring.
Yeah. But I think a kid goes through life, as talking about young kids here, and they turn to their parents. Their parents are the fixers. Whatever the situation is, you go to mom or dad or both, and they're problem solvers. So all of a sudden you're in this situation and kid is looking to the problem solvers to kind of fix it, and it's not that simple. And so I think that creates a lot of frustration on everybody's part that way as well, because you're the, mom and dad are supposed to be able to handle things, and sometimes it just doesn't work out that way.
Right. And I think it's hard, especially if mom and dad or nobody else has a sense of what's going on. I would think of an example of like a child who has OCD with a parent, obsessive compulsive disorder, but the parents and the teachers happen to not know so much about this child's version of this disorder. And now after finally a year or two later that they have a diagnosis and have more knowledge, and the parents thinking, wow, but I was yelling at my child when they kept doing that again and again, and I didn't understand, and what have I done, and how harmful could that have been?
Well, go ahead, sorry.
Oh, so I was just saying, this is a really tough place to be in, and these are the sorts of things that I think this is part of the reason why parents should be looking at what sort of support they have, or even teachers, what sort of support, so they can kind of talk about their experience of what's happened to them.
Well, your answer was an interesting segue into the next question. And again, we'll talk about TS here, but I'm sure it applies to probably OCD and ADHD as well. But the point is, it's a genetic disorder, and basically the kid is saying, thanks a lot, mom and dad. How do you get your child to accept the diagnosis and move beyond blaming parents for the genetic component, and basically just moving on and understanding it is what it is, and let's find out what works in your case?
I think sometimes with a child like that, the way out is to hear them out and really actually, if I had a child who was saying that, well, it's a genetic, you gave this thing to me, I would actually try to be supportive. I'd say, yes, I realize how hard this is, and it's hard for me too, knowing that. And part of the reason I'm doing that is because I think in a moment like that, I'm really just trying to be empathic for what the child is going through. So I think if we can't start there, being able to kind of contain what the child's saying, and it's hard for a parent to have a child who's blaming them, but if they can't contain that, it's going to be hard to move on to solutions. So I don't think we'll be able to say, yes, it's true, but it doesn't matter, let's figure out what we can do about it, until we've said, yes, that's really a hard thing, and I think we all feel terrible that I've passed this on to you. It's a hard thing to do as a parent. But so I would try to support the child's experience, whatever it is. Like I said, that can be a tough place for a parent with a child who's very upset.
Yeah, or if the child is now an adult or a young adult in any event, and having their own difficulties with their own education and their own job search and all of those kinds of things. So I think that also compounds it a little bit.
Yeah.
What would you say about the comfort level for kids to speak about their visible or otherwise differences, whether they're not so visible even? The comfort level changes, it seems to me, when they hit middle school. There seems to be a lot of resistance at that age to sharing anything about yourself that's different. So could you talk about that a little bit?
Yeah, it's tough because, and I can think about it in the Tourette syndrome community, it just so happens that middle school is probably the time when you're seeing the worst of the tics for a lot of children. And then this is the time where they are pre-adolescents and very self-conscious. And so to have a difference has become that much worse. If I had a proactive plan for that, I would want to have a child who has been talking about this all along, where if I have a 6-year-old and I'm worried about what it's going to be like when they're in adolescence and really won't want to talk about it, I'm hoping that the 5 or 6 years I have before I get there, I can really start forming good habits where the child is used to talking about it and used to people knowing about it. But sometimes we don't have those luxuries because we already have the middle schooler who really doesn't want to speak about it. And I would, again, in those situations, try to find places where they could be comfortable talking about this difference and that it's visible. So this would be the sort of place where the child with tics who's in middle school could really benefit from being at Camp Bernie and seeing other children. But beyond that, I mean, I think that, again, I'm always an advocate of meeting kids where they're at. So if they're really not wanting to talk about it, then I would also always want to be saying, yeah, I know this must be a terribly hard thing to talk about. I mean, it must be really frustrating to be at school and have this difference. And this is the sort of thing, if a child is really struggling, again, it might be helpful for them to have counseling. I would try to identify sources where I feel like they could. That uncle who has a similar thing, and maybe that's the place where the child can talk about it. I think into adolescence, the other challenge is sometimes the child doesn't want to talk about these things with their parent. And so if a clever parent can find potential other outlets where the child can open up, that can be helpful.
Well, I just checked the clock and I realized that we are out of time, so I am going to end the Q&A for tonight. Questions that did not get answered will be posted to our chat board. And Dr. Eubank, thank you very much.
You're quite welcome.
Thank you all for joining our webinar on building positive social environments and reducing stigma for children. There is an exit survey which we need everyone attending to fill out. The discussion board is now open and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the website shortly. Our next presentation, Nothing to Talk About But Fear Itself, How to Interact with Your Children About Anxiety, will be presented by Dr. Joelle Beecher-McGovern and is scheduled for October 26, 2011. This ends tonight's webinar. Thank you, Dr. Eubank, for your presentation, and thank you, everyone, for attending. Good night.